What's your view of the treatment approaches that are offered for depression conventionally? They tend to be medication approaches, psychological therapy, which is talking therapy,
Yeah.
and some social or environmental aspects, looking at what your situation is and trying to improve that.
Right. I think for me, the sort of social type aspects weren't a problem because there wasn't really a reason for the depression. Well, there was, but not a social type problem for me. It was sort of, I was explained that it was like a chemical thing, so I needed the medication. Once the medication was right, for me, it was like having a light switched back on, and it literally was like that. I was on a venlafaxine, which and very high, quite a high dose, I believe, 375 milligrams at one point, plus lithium, which they tried at one point. And once I was given the lithium, it was like a light switch going back on. I then sort of, it was like getting up one morning and feeling better.
Yes, so you're an advocate of medication, because I know
I am.
People's views of psychiatric medication, mental health medication vary a lot. But in your case, they were effective.
Absolutely. It did seem to for me to be the answer. And I did have therapy, talking, psychotherapy, counselling, whatever you'd call that. Each time, actually, I've been depressed. That's always been part of the treatment as well.
Were you well enough to receive that?
Initially, when I go in, I would have said no. I didn't probably respond at all, particularly, but gradually, yes. I think as I started to feel better, then it did help, because you could sort of talk about things, and obviously the people that were treating me guided me and talked to me as probably you would, to find out what sort of things were behind this depression.
How long did you feel that the depression was there for on these key occasions? How long did it last for?
I would say 4 to 5 months at least.
Which is a long time, isn't it? A very long time to be depressed.
Yes.
Especially when during that time your life is really dominated by it.
Totally.
And you feel that you're stuck there.
Yes. Absolutely. I mean, and my sister used to come and see me every night when I was hospitalised, actually. She'd come from work every night, and apparently I used to say to her the same things every time, which was, why am I like this? I'm not always like this, am I? And she would say, no, you're not. And it would be that same pattern, because I was desperately trying to rationalise it and couldn't.
Do you remember those phases, or is the memory for those periods when you were that unwell a little bit patchy?
Yeah, it is patchy, very patchy. But I do remember feeling like, particularly when I was prompted, I can picture myself back there, sat with her in that ward, and going through the same thing. And then she'd say, well, shall we go for a walk? And I'd sort of say, come on then. And, yes, I can. And it's horrible, really, but I can at least look back at it now and not feel too badly about it.
What do you remember about the improvement process? Was there something that you can remember? Oh, I remember when I started to do that thing, that I hadn't done in a while, and it was like a symbol of improvement.
Yes, I think it was when I could go home for visits, which was quite an incentive, even though the thought of it also petrified me as well. But initially, once I'd got home and found that it was okay to be at home again and coming back in, and I was able to sort of, I think, just take more care of myself. I was interested in clothes again, and just gradually started to feel I was interested in other things and other people, probably, rather than being focused mainly on how awful I was feeling. And being me in this hospital.
Having been through all of that,
yes.
everybody would want to avoid that situation again, and obviously we need to think about that. But from your point of view and from a viewer's point of view, is there anything that you would advise regarding, feeling slightly vulnerable because of an event like the cancer diagnosis or, a life event, and having that sense that, well, depression could come back? Is there anything you would advise regarding prevention?
Yes, I think the last sort of 2 episodes I've had of depression, including this when I had the cancer, when you actually look back at my depressions, there have been, as you just said, major events really, in terms of having my children and then losing my husband. So yes, I think for me, I would immediately go to my GP, as I did this time, because I had more of an insight. Didn't have that to begin with, but I now have. The minute I start to feel anxious or worried about things and it won't go away, or my sleep pattern starts to disintegrate, then I'd go to my GP straight away and go onto medication, because I know that that's what I'll need to do. And even then, I still know I'm going to go to rock bottom. And at that point, I can still think, yes, but you have got better before. It's only when I'm then at rock bottom that I lose that, even, that I think, I'm never going to be the same.
Do you think there's anything further that should be done for the general population in terms of anxiety and depression, in terms of, I don't know, maybe population screening or resources that are available or public education?
I think education, definitely, because depression does tend to be the sort of thing that's people don't want to talk about, or call it other things, stress, whatever you want to call it. So I think it's good, because it does seem as though things are better than they used to be, that people will talk about things and what depression is like. But of course, there's so many sorts of depression, aren't there, really? The treatments as well, when you hear some of the treatments that people have, and I mean, I can remember being put off when somebody said to me, you'd probably have to have ECT, which is still used. And I actually did have one treatment of ECT and then said I didn't want it again. But I mean, I think the more you talk about things, the better it is, because you are aware of them and they're not so undercover and so worrying, because